నమస్తే జీవనరేఖ కార్యక్రమానికి స్వాగతం. నేను శిల్ప. ఆహారం మరియు దంతక్షయం నుంచి దంతాలకు ఎటువంటి రక్షణ కల్పించాలి? పిల్లల బొటనవేలు చప్పరించడం అలవాటు పెరుగుతున్న కొద్దీ ముఖ కవళికలు దెబ్బతింటాయా? పిల్లలు పడిపోయినప్పుడు విరిగిన దంతాలను ఎలా సరిచేయాలి? అమోర్ హాస్పిటల్ నుంచి పీడియాట్రిన్ అలాగే డెంటిస్ట్ డాక్టర్ రీతు భవనం గారు మనతో ఉన్నారు. వారిని అడిగి మరిన్ని సందేహాలు నివృత్తి చేసుకుందాం. అలాగే మీ సందేహాలను కూడా స్క్రీన్ మీద కనిపిస్తున్న నెంబర్కి కాల్ చేసి నివృత్తి చేసుకోవచ్చు. నమస్తే డాక్టర్ గారు.
హలో.
డాక్టర్ గారు, ముందుగా మిల్క్ టీత్ అంటారు కదా, పాల దంతాలు. సో ఇంపార్టెన్స్ ఏంటి ఆ పాల దంతాలకి?
Milk teeth are very important when it comes to maintaining space. Not only eating, they also maintain space for the permanent dentition. Okay, so many dentists will and many people and old people also of old thinking feel that these are milk teeth. They can get away with the milk teeth. They will get new teeth. So, but these teeth are important as space maintenance for your new dentition which is going to come. So, they have their own importance. They are important for the growth of the jaws, and overall they act as space maintainers, and that is why we have a special branch called pediatric dentistry. For children teeth, you must visit a pediatric dentist because they will be able to do the correct treatment for these milk teeth.
ఓకే. సో అండ్ నర్సింగ్ కేరీస్ అంటారు కదా, సో అంటే ఏమిటి?
Nursing caries is with wrong feeding habits. Children, you must have seen children where all these small black teeth. People think that as and when the tooth came into the oral cavity, it was black. It was not black when it came into the oral cavity. It is because of wrong nursing habits that it became carious. Normally what happens is people will feed breastfeeding or bottle feeding and the child will go off to sleep. But actually they should be giving some amount of water so that it will get cleaned. Milk will act as a cariogenic agent, but milk is important for the child's growth also. So we have to do balance. We have to give some amount of water following feeding so that we don't land up having nursing caries. Also, there are ways to clean the small teeth. Most people ignore that these teeth, they don't need cleaning. Okay, only giving milk is enough for their growth, for the development of the child. But it's not like that. You have to do some amount of regular cleaning. You can see on the screen, this is a perfect example of nursing caries. Okay, so these caries can be prevented with proper cleaning. And how do we do the cleaning? The cleaning has to be done with the wet gauze. When the child first tooth erupts, before the gum pads, when the child is born, he will not have any teeth. So proper cleaning has to be done from that time onwards. And when the first teeth erupts, that's when you have to start doing little bit of brushing and maintaining, having, if you see any cavity like lesions in the oral cavity, you must visit the doctor so that you don't land up having a bad situation.
ఓకే. సో అండ్ వాట్ అబౌట్ అంటే డైట్కి అలాగే డెంటల్ క్యారీస్కి సంబంధం ఏమిటి, రిలేషన్?
Yeah, diet is very much related to dental caries, as in we all know chocolates and chips will lead to cavity. Yes, that's a very common thing, everybody knows. But what is new that I am going to tell you is that not only sticky things cause cavities, but also more refined food also causes cavity. So if you take lot of fibers in your diet, okay, for children also, that is more healthy rather than giving them breads, burgers, patties, puffs. All this maida and all, they are very sticky. These are refined carbohydrates. We have to avoid these refined carbohydrates. We have to give them more fibrous food for children also. Okay, going for a fibrous food, and then you can give alternatives. There are very many children who are very addicted to sweet, sugar. So how do we get them? We can't refrain them from sugar suddenly. So what do? You can give them alternatives. Peanut butter is a better alternative to jam. Okay, and some children are very addicted to chocolates. You can't suddenly take away chocolates from them. So you have concepts of sweet bank. You have to tell children, okay, అన్నీ ఒక్క దగ్గర పెట్టుకో, సండే రోజు అన్నీ ఒక్కటేసారి తిను. ఓకే, సో హౌ మచ్ విల్ ద చైల్డ్ ఈట్ ఒక్కటేసారి? he or she will eat maximum 5 or 6, then they will be also full. So this is a sweet bank concept. So you have to alternate their diet and change them and get them to a normal diet and introduce, healthy diet. More than refined carbohydrates, you have to get them to taking fibrous foods, fruits, carrots, cucumbers. These are the things you have to introduce to child. We think as parent shortcuts. We should not think of shortcuts, because in the long term they are going to hamper the child. So we have to think of healthy options for the children. And for that matter, I would like to tell that there are foods like groundnuts, they don't cause acidity in the mouth, they cause alkaline atmosphere, so they prevent caries. So if children is used to, give them some peanuts after food if they've had lot of chocolatey, or you think it is sugary diet, child is addicted to sugar or wants sugar in everything, then try to introduce some peanuts to them after the food, so that will bring down the acidic atmosphere of the mouth. So such alterations, alternative to diets, you have to suggest to the children. Children are very much influenced by advertisements, and advertisements are all about sugars. As parents, we have to introduce them to a healthy diet, and so diet is very much related to dental caries.
సో ఇప్పుడు మీరు చెప్పారు పీనట్స్ తీసుకుంటే మంచిది పిల్లలు.
As snacks.
Yes.
Alternative snacks to chips.
ఓకే, బట్ అంటే ఓన్లీ పీనట్స్ కాకుండా అంటే చిక్కీ రూపంలో తీసుకుంటారు ఇంక్లూడింగ్
But then it again becomes sticky.
yes, that's why I'm asking.
No, not sticky, but just as peanut butter alternative to jam, and peanuts introduced, followed by, if a child has had some things, if a child is addicted to chocolates, then you get chocolates which have peanuts in them. For a while they might help you to get the child rid of chocolate, so just we can't suddenly wean the child from sugar to no sugar. No child will accept it. So you have to give alternatives, as well at the same time you have to give them little bit of freedom in the form of sweet bank. Collect all your sweets together. Whenever you have your best program coming on the TV, eat that and finish it off all together within 1 hour. So they will be okay, I am getting that freedom to eat my chocolates on that one day with my best show. So they will try to wait for that moment, and in the same way they will be able to reduce the effect that the sugar is having on their body gradually, and finally one day they might leave it also.
Okay.
Daily becomes an addiction. We are trying to get the child rid of addiction.
సో వీక్లీ వన్స్
Yes, weekly once and all together, because what matters in caries is the number of attacks. So the concept behind the sweet bank is you reduce the number of attacks to 1 attack in a week.
సో మీరు చెప్పిన కాన్సెప్ట్ అయితే చాలా బాగుంది. నిజంగా పిల్లలు చాక్లెట్స్ తీసుకుంటే వాళ్ళు ఒప్పుకోరు, బట్ చాక్లెట్స్ షుగర్ కంటెంట్ అనేది వాళ్ళకి మంచిది కాదు కాబట్టి సో డైలీ ఇవ్వకుండా, డాక్టర్ గారి కాన్సెప్ట్ ఏంటంటే డైలీ ఇవ్వకుండా మీరు ఒకేసారి ఆ చాక్లెట్స్ అన్ని గ్యాదర్ చేసి వీక్లీ వన్స్ మీరు ఒక సండే తీసుకుని ఆ సండే రోజు ఈ చాక్లెట్స్ అన్ని వితిన్ 1 అవర్లో కంప్లీట్ చేయాలి అని పిల్లలకి టాస్క్లు ఇస్తే ఖచ్చితంగా వాళ్ళు ఆ సండే కోసం వెయిట్ చేస్తారు, రోజు తినకుండా. ఆ సండే రోజు 1 అవర్లో ఎక్కువ తినలేరు కాబట్టి సో ఖచ్చితంగా వాళ్ళకి ఆ మైండ్ అనేది తగ్గుతుంది, రెడ్యూస్ అవుతుంది చాక్లెట్స్ తినడం కూడా. 1 అవర్లో ఎక్కువ తినలేరు కాబట్టి సో ఇలా ఈ కాన్సెప్ట్ని ఫాలో అయితే ఖచ్చితంగా పిల్లల్ని ఈ షుగర్ కంటెంట్స్ చాక్లెట్స్ నుంచి కొంచెం అవాయిడ్ చేయడానికి వీలవుతుందని చెప్పి కూడా ఇప్పుడు డాక్టర్ గారు చెప్పారు. దట్స్ ఎ గుడ్ కాన్సెప్ట్. సో డాక్టర్ గారు అలాగే చాలామంది పిల్లలు అంటే వాళ్ళకి ఓల్డ్ టీత్ పోయి న్యూ టీత్ వస్తుంటాయి కదా, సో కేర్ తీసుకోరు పేరెంట్స్ కూడా. అంత క్లీన్ చేసుకోకపోయినా బ్రష్ చేసుకోకపోయినా నష్టం ఏం లేదు, కొత్త పళ్ళు వస్తాయి, న్యూ టీత్ వస్తాయి అని చెప్తూ ఉంటారు. సో అది కరెక్టేనా?
That's wrong. That is totally wrong. As I said, milk teeth have their own importance. Not only they build the confidence, but when the child is growing, so many things are happening together. The psychology is growing. If a child doesn't have front teeth, they will feel shy. They won't talk to people. Then psychologically they'll become weak. Public fear will set in. Speech is developing. when the child is growing, the speech is developing. You must have seen so many children when they are small, their speech is not clear, but as they grow the speech becomes clear. But teeth are also playing a very important part in the formation of speech. So when they don't have front teeth, they've gone bad, the speech will also be not so good. There will be hampers in speech. You must have seen so many children, for sir they say shh, the air will pass out.
Yes.
So there is so many things that these male teeth play a role in. It is not only pote poni kottadi vastayi. No, that is not the concept. That's the concept. That's why we are here as pediatric dentists, to change that mindset. We are looking at the overall development of the child. Okay, so speech, psychological, as well as I said, they maintain space for the new teeth. As we are seeing on the screen, there is a picture where you can see, this one, in which, see, this new tooth has been blocked because the milk teeth was removed prior. So they have got tilted. Now there is no space for the new one to come out. Okay, so these are the factors that we have to look in when we are saying milk teeth are important. They have to be taken care of. We have to brush regularly, daily. So it is regularly means daily, not irregularly, once in a week or twice in a week. Some children getting ready for school, oh vadle se school ki podam. It's not like that. You have to brush your teeth regularly. Regularity is what is important. Twice brushing, even more good.
ఓకే, సో మీకు కూడా టీత్కి సంబంధించి, ముఖ్యంగా పిల్లల్లో టీత్కి సంబంధించి ఎటువంటి డౌట్స్ ఉన్నా, సో నార్మల్ డెంటిస్ట్ కాదు, పీడియాట్రిక్ డెంటిస్ట్ని కన్సల్ట్ అయితేనే పర్టికులర్గా మీకు ఉన్న సమస్యకి క్లియర్ కట్గా ప్రాబ్లం సాల్వ్ అవుతుందని చెప్పేసి కూడా చెప్తున్నారు. సో మరి పీడియాట్రిక్ డెంటిస్ట్ మన దగ్గర ఉన్నారు కాబట్టి మీకు లైవ్లో అందుబాటులో ఉన్నారు. సో మీకు ఏదైనా డౌట్స్ ఉంటే కాల్ చేసి క్లారిఫై చేసుకోవచ్చు డౌట్స్ని. సో అలాగే డాక్టర్ గారు, రెగ్యులర్ చెకప్ కోసం మనం ఎంత సమయం కేటాయించాలి?
Every 6 months we have to visit the dentist, because sometimes the cavities, these male teeth are very small, and the thickness of enamel and dentine. Tooth is made up of enamel and dentine. Yes, we have read it all in class 5 and 4, the layers in the teeth. The thickness is only 1 mm. So the caries spread is very fast. So 6 months checkup for every child is very important, so that if we can see a cavity which is coming up or growing, we can clean it up right away. And very importantly, once you get a cavity in the mouth, it tends to spread, because now bacteria have got their house and they will spread. Okay, and you must have seen so many children, one tooth and then next tooth, adjacent tooth, opposing tooth, they all get infected very fast. Okay, because once bacteria get house into your oral cavity, it has a tendency to spread faster. So cleaning, once you see and you get it immediately cleaned, and a regular maintained checkup at 6 months. Anyways, children will get holidays every 6 months, so parents can find little bit of time to go and get a checkup done, or if they see some black spot, they can report it to the dentist and get it cleaned immediately.
అంటే పెద్దవాళ్ళకి కాదు, పిల్లలు కూడా ఎవ్రీ 6 monthsకి ఖచ్చితంగా రెగ్యులర్ చెకప్ చేసుకోవాలంటారు.
Yes. Okay. And even more important when the child is at the age of 6, because that's when the first molar erupts. Those are permanent teeth. Many parents who come to us, they feel, oh, these are milk teeth, what are we, they are not of any importance. Kotta teeth are the first nunchi, front nunchi vastayi. No. It is this first molar, which is called as 6 years molar, which will first come at the last of the end of your primary dentition. So these first molars, which should be 4 in number, are the ones which you have to take care right from the age of 6, because they have come at the age of 6 and they have to last till the age of 60. So that's a very long lifespan that they have to cross. So you have to take care of these teeth even more.
Okay.
Yeah, and these are not milk teeth, they are permanent teeth, and for that is what we recommend sealants. Okay, sealants, when we just seal the top layer by not cutting anything. We just seal it with a fluid. It is a resin, and it will make the area self cleaning, because when the child is small, 6 and 7, they don't brush till the end. They do brushing only like this, front brushing, and they are ready to go. So these are the teeth which get infected very fast because of their anatomy also, because the grooves are very deep. Since the teeth is new, they are very deep inclines, very deep fissures. Children don't clean them well, so you'll end up having cavity in sixes at a very early age.
సో అలాగే చాలామంది పిల్లలకి థమ్ ఫింగర్ అనేది ఇలా చప్పరించడం అలవాటు ఉంటుంది. సో అది వాళ్ళ ఫేస్ని చేంజ్ అవుతుందా వాళ్ళ ఫేస్ దానివల్ల?
Yes, habits make a very important part in the growth of the face, you know, because they disturb the balance of the face. One such habit, as you mentioned, is thumb sucking. There are other oral habits also, like tongue thrusting. The tongue will come in between, not stay behind the teeth. It will come in between the teeth, okay? And then you have many other mouth breathing. You must have seen children who will open their mouth and sleep. Yeah, so these are some oral habits which have to be looked into at a younger age, because then they spoil the whole face. Most of the children who do mouth breathing have a very long face, okay, and their muscles are very weak. Okay, and similarly, children with thumb sucking habits, you must have seen the teeth will come forward.
Yes.
They will be spaced. Why it happens? Because they disturb when the thing is not supposed to be there and you place it there, it disturbs the balance of the mouth. These muscles are having a different balance with teeth and the tongue, and when you put the thumb inside, it pushes the tongue down, and so they become more active and they squeeze, and the arch becomes like this. Instead of becoming a U, beautiful U, it becomes like a V, and so these teeth will jet out.
Yeah.
So habits have to be corrected early. But yes, when many children will have habits up to 3, we consider normal. It is very difficult to overcome any habit till the age of 3, because child will not cooperate. It's only later that we can introduce something, take their help, and they will cooperate. As you can see on the screen, we have one small girl having thumb sucking habit, and she cooperated very well, because we have to motivate the child. Motivation happens only when they reach to a certain age. If you expect tomorrow, doctor, I came to you, you know, my child is having thumb sucking at the age of 2, I can't correct that thumb sucking, because that is a drive. Children, very small kids, they have a drive. We can't correct that drive. It's only after a certain age that we can put some effort and do the thumb sucking, habit correction, mouth breathing correction. You know, there is an age to correct those habits, but they have to be corrected.
సో డాక్టర్ గారు, పిల్లలకి చాలామంది ఎక్కువ ఆడుకుంటారు కాబట్టి పడిపోయినప్పుడు దంతాలు అవి విరిగిపోతూ ఉంటాయి. సో అట్లా బ్రోకెన్ టీత్ ఉన్నప్పుడు మనం ఎట్లా మేనేజ్ చేయాలంటే ట్రీట్మెంట్ ఏమైనా ఉంటుందా దీనికి కరెక్ట్ చేయడానికి?
Now that is a very beautiful question. As in, when children fall, it can be a small child who has not yet got his permanent teeth, and it can be a child who has got his permanent teeth. Now we have 2 scenarios. If the first child who has not got his permanent teeth, yes, we do take care of those teeth also, as I said, because they are important for speech development, psychological development. If we are able to retain that tooth, well and good. We always try to keep that milk tooth also in the child's mouth, okay, by doing some splinting or some root canal. We'll try to keep that tooth in the mouth in position. Now, but there are circumstances when the tooth avulsed, it just came out of the socket. A milk tooth, when it comes out of the socket, we don't place them back. We might give an alternative to the child to place, so that he can overcome his speech and other difficulties. But if it is a permanent tooth which has got damage, we have to try to save it 100%. If it has got damaged, there are certain procedures by which we allow the root to grow. Can you see in the picture? Most of the permanent tooth, when they come out, their roots are not fully formed. They are only half. So during that time, we have to take precautions that we allow the root to grow, and at the same time we have to maintain the shape of the tooth also. Most people, when you visit a regular dentist, they might try to save the root, but they don't try to save the shape of the tooth. You have to insist to the dentist to save the shape of the tooth also, so that later there is no disbalance in the face. The midline of the face should not change. You know, that is very important thing that I want the parents to be aware of. They will just go for a root canal procedure and they will forget about the front ఓకే పెద్ద అయిపోయినాక మనం క్యాప్స్ చేద్దాం అట్లా పోతారు. బట్ పెద్ద అయినాక క్యాప్స్ పోతే ఎక్కడ పోతాయి క్యాప్స్? 2 రెగ్యులర్ క్యాప్స్ రాదు, 2 సేమ్ షేప్స్ రాదు, బికాజ్ యూ లాస్ట్ స్పేస్. Okay, so very important is to maintain the shape also, maintain the space for the shape maintenance also. Okay, so maintaining 100%, you have to maintain these permanent tooth if they have got damaged. And the first thing we have to try to do is, even if you are able to get the piece when the child is running and has managed, you might find the piece of the tooth, please get it to the dentist. It can be stuck back. Very important thing which parents are not aware of. They will not look for the piece. If you are able to look for the piece and you get the piece of the broken tooth, please get it to the dentist. It can be fixed back. It will help to maintain the shape and prevent the later discrepancy in the face look.
ఓకే, సో అంటే ఆ విరిగిపోయిన ముక్కని తీసుకొస్తే 100% ఫిక్స్ చేయడానికి ఛాన్స్ ఉంటుంది.
Yes.
సో పలానా టైం లోపలే తీసుకురావాలని ఏమైనా రూల్ ఉందా?
Yeah, they usually say that it should be done within 72 hours or something, but try to get it as early as possible. And if the whole tooth comes out, some children you will see the whole tooth comes out because the root is not complete. In that case, just put the tooth in milk, because it's the most easily available thing, or coconut water. Do not dry the tooth. Get it in milk or in coconut water and report it to your dentist. It can be placed back.
సో మిల్క్లో కానీ కోకోనట్ వాటర్లో కానీ మనం ఉంటే అది కొంచెం డ్రై అవ్వకుండా ఉంటుంది కాబట్టి ఉంచి అలా
And
తీసుకొస్తే
should not
ఫిక్స్
touch
చేస్తారు.
the root part.
Okay.
Should not touch the root part.
ఓకే,
Touch the crown part and get it and report it to your dentist. It can be placed back into the socket.
సో అలాగే హౌ వీ షుడ్ హౌ వీ షుడ్ కరెక్ట్ జిగ్జాగ్ టీత్?
For correction of zigzag teeth, as in there is different, there are some corrections that can be done at a young age and some have to wait for the child to grow up. Few corrections which can be done and should be done at a younger age is, you must have seen normally our upper teeth will be on top of the lower one. Okay, this is lower, this is upper. It should be like this. You will see some children who will have 1 or 2 teeth of lower going out and this one in. Now when this happens, it stops the growth of your nose and your maxilla, the upper face. It locks, it puts a lock. So this growth doesn't happen. Such children will have not a straight profile but a concave profile. Moon laga aipotadi face.
ఓకే,
Okay, so they have to be corrected as early. We call them cross bites, anterior cross bites, posterior cross bites. They have to be corrected as and when they are noticed, and that's why every 6 months visit is important in a growing child, so that whatever we see as early as possible we can correct it. Okay, same way posterior. If you see some people whose lower jaw is out and the upper jaw is inside, in the back side, they will have facial asymmetry. This side of the face will look bigger than this side of the face. So some people think pal ante enti, only eating ena kada. No, teeth are making your face, and today the whole world is about looks. After that you have to go for surgery if you want to correct your looks. So better to take care of your looks when you're growing, and the parents have to take that effort for the child. Facial asymmetry and as I said, some anomalies which arise at a younger age can be corrected early without any problem. You don't have to wait for 13 and 14. They have to be corrected as early as possible, like cross bites and all.
Okay.
Habits, they all need intervention early in life.
ఓకే, సో అంటే జిగ్జాగ్ టీత్ అంటే సో కట్టు బయటకు అవుట్ వచ్చినవి లోపల ఉన్నవి అలా కాకుండా కొంతమందికి సో ఇలా ఉన్నది ఇలా ఉంటుంది కొంతమందికి. Yes, reverse లో
those
ఉంటుంది.
are called class 3. Even those can be corrected when it is seen early at age. You know, we can give some appliances to control the growth of this jaw. This jaw is running very fast, so we control this jaw so that this jaw can take pace. Child cooperation, yes, I know it is needed. it is needed, and such children cooperate also. It's the parents' fear. Oh, na babu cooperate cheyaru. This is your fear. Child may cooperate for his or her looks.
ఓకే సో ఓకే థ్యాంక్ యూ డాక్టర్ గారు, థ్యాంక్ యూ సో మచ్. సో పిల్లల్లో కూడా అంతే పీడియాటిక్ డెంటిస్ట్ని ఖచ్చితంగా కలవాలి, ఎందుకంటే వాళ్ళ పళ్ళ వల్ల ఫేస్ షేప్ కూడా మారిపోతుందని. సో చాలామందికి తెలియదు, బట్ చాలా క్లియర్గా ఎక్స్ప్లెయిన్ చేశారు. థ్యాంక్ యూ సో మచ్. సో ఇది ఈనాటి జీవనరేఖ కార్యక్రమం. నమస్తే.